Good morning. This is Dr. Timothy Scott Beck here at LifePoint Medical. It is February the 27th of 2023, and I want to thank you for listening in this morning. We're doing great. We're blessed to be here, and we want to hear from you. If you have any have any problems, we want to see you and get you taken care of. So let's talk about my clinical pearl first is going to be on flossing. What I found is flossing really makes a significant difference in your tooth health as you get older, and we know that poor dentition affects your heart and other things. So I recommend people to start flossing, and I think it's the most effective way to protect your teeth. And I noticed I had a lot of cavities when I was younger, and then when I started flossing, I had a lot less. So here's what I do, and I want you to listen to it specifically. When you brush your teeth, as soon as you get finished, floss while the toothpaste is still in your mouth, so that you can use that toothpaste to help floss better and to get it in between your teeth. And I think that gives you a real distinct advantage. And if you start doing it now, if you're young and you got pretty teeth and you start doing that now, 20 years from now, you'll definitely appreciate what I've done for you, or my advice on that. So something to think about. Now, next is the weight loss program we've got. We've had a great response to that, and we're giving the semaglutide injections. So one of the things I was thinking about with this program, because I really want to help people move the needle. So what I was thinking in my mind is like saying, hey, let's take a 60-day period. You sign up to get those shots, and you really focus in on losing weight during those 2 months. Okay, I think you could be very effective with these medicines in doing that. And I think you could get a lot of weight off, maybe 30, 40 pounds. Now, that's a lot of weight loss pretty quick, but the other focus would be on making sure when you stop the medicine that you didn't have some kind of rebound from on. You stayed there, and we'd have to doggedly go after that, because that's part of the issue with any kind of weight loss program, is you getting that rebound afterwards. But help people knock off 30 or 40 pounds and feel better afterwards, because you're going to have less medicine. You got less stress on your knees and on your heart. You're just going to feel better. You're going to look better, but that's not my motivation. But I just feel like giving somebody a definitive time. Hey, 2 months. Let's knock off 30 pounds. Let's move the needle and make you feel better, I think is the way I'm going after that. So it's going to be a really good thing, and I definitely want to partner with you to get that done. Next, I want to talk a little bit about my clinic involvement, because that's an area of contention. People really, this is probably the only negative comment we get every day, is people want to see me when they come. Now, not everybody wants to see me, okay? Some people would just say not see me. However, they want me to be there when they're in medical trouble, or they need something more than just a refill or something like that. And I understand that. So the way we do it here in the office is I have the providers who see all the patients primarily when they come in. And then if they think I need to see you, or you want me to see you, they can simply step out and they put up a special flag that tells me, hey, this patient, I need you to see this patient, or this patient needs you to see them. And that's how we're doing it around here, and it's worked really well, because I'm throughout the office all day long. Okay, I'm the first one here, I'm the last one to leave, and I have got my hands on everything in this office, trying to make sure it goes as good as possible, okay? And making sure you get what you need and everything. And I'm completely working on it all day long. The only caveat is sometimes I get hung with a serious patient, somebody who's really sick or really needs my special attention. And those, it's hard to cut them off short. You just got to take care of the patients. And the only thing I can say is I will see you if you're willing to wait on me if I'm hung up. Okay, but again, that's mediated too by the providers. I've got other providers. They're very competent. They know when it's time for me to come in, and that's part of their job, is to let me know if you need to be seen. So if you're in here and you want me to see you, and I'm working that day, I don't work on Fridays typically. I have other things I have to do on Fridays. So I leave that as my day to not be in the clinic. You can always have them put out the flag, and I'll see you if I'm here in the office. And we really just want you taken care of in the best way possible, I promise you. Otherwise, we got the surgery that came. They're coming every other week, and they've got a few patients every other week, and they're doing good. And we've already had some people who are treated by them, and we've all are doing well from that. I will tell you that if we're going to have local services, we've got to promote our own local services, okay? And we've got to use them so that they can stay. So that's one of the motivations for this is how we need a general surgery in this area, general surgeon, and this is the closest one I could find, and I think they're going to do really good for us. And they just came from Northeast Georgia, so they're all plugged into the system through here. So it's really a win-win for everybody if we could get some general surgery services going up here out of my office. All righty, thank you so much for listening to me today. I appreciate it. I really want to be here for you. I'm living my dream of taking care of the people of this community. And I always appreciate people's trust they put into me because I really just want to do a good job and make a significant difference in people's lives. And so I appreciate you listening. You have a good week, and you call us if you need us, okay?